Hi guys, today we are discussing androgenetic alopecia and treatment of androgenetic alopecia. This is picture of 26-year-old boy and he started hair fall 5 years back when he was 21-year-old. So in what is the course of androgenetic alopecia, it should be known to us and I will make it simple for you. Usually, androgenetic alopecia means inherited losses. They start in young boys at the age of 20. And 20% of the whole population who are intending to go for baldness, they start getting bald at the age of 20. 20% of them. And thumbnail is 10% of the baldness increases every decade. So 30% will become bald at 30 and 40% will become bald at 40. So we need to keep in mind, if a boy comes to you at the age of 20 with certain baldness, where I will show you the pictures of him from the crown as well. When he is bald in early ages, what would be happening to him at later ages? So this is the thing which we need to keep in mind to treat this patient on, to avoid him, to prevent him for getting more bald in coming ages. So we need to do two treatments. One is medical treatment, other is surgical intervention. So when we are talking about surgical intervention, we will go for FUE and FUT treatments. And why we are intending to do medical treatment? Because we need to prevent hair fall for certain reasons, because we are always been limited in the donor area. So donor area is very limited, and how many grafts can we take from a quality donor area? Quality donor area means if the patient is having good number of hair, good amount of hair per centimeter square area, and with a good caliber as well and good elasticity as well, because we need to mix both procedures like FUT and FUE for younger patients to save the donor area for coming ages, and because he will be having baldness, more baldness in the coming ages at 40s or 50s, or he will be needing more hair to transfer from permanent donor area to the recipient area. So we will discuss this particular case. He is getting bald from this area. He has put actually hair in frontal direction to hide the frontotemporal angles. I will show you in next picture. See the next picture, what is happening to him. Look, he is bald from the right frontotemporal area. Look, I will show you the area. He is bald in this frontotemporal triangle. So, and this area as well, it is getting thin. So we need to sort it out that he is bald in this area. And you will be surprised with the next picture as well, because when I will show you the next picture, it is like this. He is also getting bald from at the crown area. So we need to be very careful, and you can do it. And if patient is committed, we can prevent him in going to further losses. We can prevent losses extending to this area. We can prevent the losses getting into this area and this area. If we are not going to do some medical treatment, if we leave him untreated, what would be happening to him is, this will be going down, this will be going on the lateral side, this will be going on this side, and he will be getting bald in the frontal area as well. So we need to keep in mind that along with surgical treatment, along with filling this area in a boy of 26, we should be giving him medical treatment. What is medical treatment? Finasteride and minoxidil. If you are intending to stop hair fall for a certain period, you will give him minoxidil and finasteride for 2 years. And what would be happening to him? He can prevent further hair loss for next 4 years, 2 years treatment to next years, and he will be entering into early 30s after saving this whole scenario. And what would we do to him is, we will do hair transplant in this area. We will put like 1500 grafts in this area, and we will put 700 or 800 grafts in the frontal area to cover the front and crown as well. But if the patient is agreed to go for medical treatment for a longer time, then we can opt for hair transplant in this area. Otherwise, it is absolutely not recommended to do hair transplant in the vertex or crown area, because priority area is frontal area. And as I told you in the earlier message, that we need to save the donor area for further losses, and we are always limited at the donor area. How many grafts we can take from the donor area, this is another debate. I can tell you in another separate lecture, because it takes like 20 minutes to explain it to you, how many grafts we can take from the safe donor area, and what is safe donor area, and what is semi-safe donor area. So what is the option to do hair transplant in this patient? What is the procedure we can select for this particular patient is, we can do only follicular unit transplant, which is now called linear strip surgery for this patient. So we will be going for this particular patient, we will going for FUT or LSC, which is called linear strip axion surgery for this particular patient. Why am I interested to opt for that? Because we want to take the most permanent hair to put in the frontal area and a little bit in the crown area, because he is a young boy and I don't want to send him in the social stresses at the age of 26, while he is very much committed and up for taking finasteride and minoxidil for longer periods, because he can understand very well the importance of finasteride and minoxidil to prevent the hair loss in this particular condition, in this particular scenario, while he is having the frontal loss as well. I will show you the next picture. He is also getting bald in this area. So we can fill in up this frontotemporal line, and we can do some hair transplant surgery in this area and in this area as well, and we will fill it up with the grafts taken through FUT procedure. Why FUT procedure? I explained it to you, because these hair are most permanent and taken from the central most area on back of the head, and those hair are considered to be most permanent even at the age of 80s. So why we should not be opting those most permanent hair to put in the frontal area, so that we should be like relaxed after putting those permanent hair in this area, so because they will remain there for a longer time, and longevity is more important. So we will not be opting for FUE procedure in very young patients, because in FUE we don't want to do thinning in the back of the head, so we are not interested in doing the FUE procedure in very young patients. So I have told you, conclusion is, I have told you two things. One is medical treatment and one is surgical treatment. Both will be going parallel to each other. Will keep him up on the medical treatment, so to stop the further hair loss in future, because he is very young boy. And other is, we are not interested in sending this boy in social stresses, we will be doing hair transplant to him, especially in the frontal area, and we will be putting fewer grafts in the crown area as well. Thank you very much, boys.